Are you dealing with the discomfort of an enlarged prostate and wondering which everyday foods might be making it worse? You're not alone. Today, we'll uncover the key foods to avoid for better prostate health. Don't miss food number 6, it's a common staple you might eat daily. Understanding these dietary factors can greatly impact your symptoms. Let's dive in and discover how small changes can lead to significant improvements. An enlarged prostate, or benign prostatic hyperplasia, BPH, affects many men, especially as they age. This small gland, located below the bladder, can grow larger due to hormonal changes. Let's explore how your diet can help manage this condition. First, we have bananas. Bananas are often praised for their nutritional value and health benefits, but there are concerns that they might have adverse effects on prostate health. While bananas are rich in vitamins, minerals, and fiber, certain properties of this fruit can potentially be harmful to the prostate, especially when consumed in excess. One of the main issues with bananas is their sugar content. A medium-sized banana contains about 14 grams of sugar. High sugar intake can lead to increased levels of insulin and inflammation, which are known risk factors for prostate problems, including benign prostatic hyperplasia, BPH, and prostate cancer. Chronic inflammation in particular can create an environment conducive to the development of prostate issues. Another concern is the potassium content in bananas. While potassium is essential for various bodily functions, excessive potassium intake can strain the kidneys and negatively impact the prostate. Overworking the kidneys can lead to a buildup of toxins in the body, which may exacerbate prostate conditions. For individuals with kidney issues or those predisposed to prostate problems, it's crucial to monitor and moderate their potassium intake. Bananas also contain a significant amount of carbohydrates. Diets high in carbohydrates can contribute to obesity and metabolic syndrome, both of which are linked to increased risks of prostate cancer. Maintaining a healthy weight is vital for prostate health, as obesity is a known risk factor for developing aggressive forms of prostate cancer. Therefore, consuming too many bananas can indirectly contribute to these health concerns. Next, we have cherries. Another aspect to consider is the potential for cherries to cause digestive issues. Cherries contain a substantial amount of fiber, which, while beneficial in moderation, can lead to bloating, gas, and abdominal discomfort if consumed in large quantities. For individuals with an enlarged prostate, additional pressure on the bladder and prostate from digestive issues can exacerbate symptoms such as increased urinary frequency and urgency. Cherries also contain oxalates, naturally occurring compounds found in many fruits and vegetables. High levels of oxalates can contribute to the formation of kidney stones, which can have downstream effects on prostate health. Since the kidneys and prostate are part of the urinary system, problems in one area can influence the other, potentially aggravating prostate conditions. Furthermore, cherries are rich in anthocyanins, which are powerful antioxidants. While antioxidants are generally beneficial, excessive intake of anthocyanins can potentially interfere with hormone balance. Maintaining a proper hormonal balance is crucial for prostate health, and any disruption in this balance can increase the risk of developing prostate issues. The high acidity of cherries can also be problematic. Consuming large amounts of acidic foods can lead to acid reflux and other gastrointestinal issues. Acid reflux can cause inflammation and irritation in the body, which may have a negative impact on prostate health. Chronic inflammation is a known risk factor for the development of various prostate conditions. Next, we have carbonated drinks. In addition to sugar, many carbonated drinks contain artificial sweeteners like aspartame and saccharin. While these sweeteners are used to reduce calorie content, studies have shown that they can have adverse effects on the body, including hormonal imbalances. Hormonal balance is crucial for maintaining prostate health, and disruptions caused by artificial sweeteners may increase the risk of prostate issues. Carbonated drinks are also high in phosphoric acid, which is used to enhance flavor and shelf life. Phosphoric acid can interfere with the body's ability to absorb calcium, leading to decreased bone density and kidney issues. Since the kidneys and prostate are closely linked in the urinary system, kidney problems can have a negative impact on prostate health, exacerbating conditions like benign prostatic hyperplasia, BPH. Moreover, the caffeine content in many carbonated drinks can pose risks to prostate health. Caffeine is a diuretic, which can lead to increased urination and bladder irritation. This can aggravate symptoms of prostate enlargement and prostatitis, causing discomfort and worsening urinary issues. For men with pre-existing prostate conditions, limiting caffeine intake is essential to managing symptoms effectively. Another concern is the presence of bisphenol A, BPA, in the plastic bottles and aluminum cans used for packaging carbonated drinks. BPA is an endocrine disruptor that can mimic estrogen in the body, potentially leading to hormonal imbalances. Increased estrogen levels have been linked to the development and progression of prostate cancer. Opting for BPA-free packaging or reducing consumption of bottled and canned beverages can help mitigate this risk. Next we have citrus fruit. The high acidity of citrus fruits can also lead to acid reflux and gastrointestinal discomfort. Acid reflux, in turn, can cause inflammation and irritation in the body. Chronic inflammation is a known risk factor for the development and progression of prostate issues, including prostate cancer. Men with pre-existing prostate conditions may find that consuming acidic foods like citrus fruits worsens their symptoms. Citrus fruits contain a significant amount of natural sugars, particularly fructose. High sugar intake can lead to increased insulin levels and inflammation, both of which are detrimental to prostate health. Elevated insulin levels can promote the growth of prostate cells, potentially contributing to the development of prostate enlargement and cancer. Managing sugar intake is crucial for maintaining hormonal balance and reducing inflammation. Another concern is the potential for citrus fruits to interfere with the absorption of certain medications. Citrus fruits, especially grapefruits, are known to interact with various medications, including those used to treat prostate conditions. Compounds in citrus fruits can inhibit the activity of cytochrome P450 enzymes in the liver, which play a key role in drug metabolism. This can lead to increased levels of medication in the blood, potentially causing adverse effects and reducing the efficacy of the treatment. The high levels of flavonoids and antioxidants in citrus fruits, while generally beneficial, can also pose risks when consumed in excess. These compounds can interfere with hormone levels and potentially disrupt the balance of testosterone and estrogen in the body. Hormonal imbalances are linked to the development and progression of prostate conditions, including prostate cancer. It's essential to consume citrus fruits in moderation to avoid these potential hormonal disruptions. Pesticides and chemicals used in the cultivation of citrus fruits also present a concern. Non-organic citrus fruits are often treated with pesticides that can act as endocrine disruptors. These chemicals can mimic or interfere with hormones, leading to imbalances that affect prostate health. Opting for organic citrus fruits or thoroughly washing conventionally grown fruits can help reduce exposure to these harmful substances. Next we have dietary. The presence of hormones in dairy products is another significant issue. Dairy products often contain natural hormones, as well as synthetic hormones that may be used in dairy farming to increase milk production. These hormones can disrupt the hormonal balance in the body, particularly the balance of estrogen and testosterone. Hormonal imbalances are known to contribute to the development and progression of prostate conditions, including benign prostatic hyperplasia, BPH, and prostate cancer. Additionally, dairy consumption can lead to increased levels of insulin like growth factor 1, IGF-1, in the body. IGF-1 is a hormone that promotes cell growth and development, but elevated levels of IGF-1 have been linked to a higher risk of prostate cancer. The growth-promoting effects of IGF-1 can stimulate the proliferation of prostate cancer cells, making it a critical factor in the relationship between dairy consumption and prostate health. Dairy products also contain significant amounts of calcium, which, while essential for bone health, can be detrimental to prostate health when consumed in excess. High calcium intake has been associated with an increased risk of prostate cancer. Excessive calcium can inhibit the synthesis of calcitriol, a form of vitamin D that has protective effects against prostate cancer. Maintaining a balance of calcium intake is crucial to avoid these negative effects on the prostate. Another aspect to consider is the potential presence of pesticides and other contaminants in dairy products. Cows are often exposed to pesticides through their feed, which can then be transferred to the milk and dairy products they produce. These pesticides can act as endocrine disruptors, interfering with hormone function and potentially increasing the risk of prostate issues. Choosing organic dairy products can help reduce exposure to these harmful substances. The inflammatory response triggered by dairy consumption is another concern. Some individuals are sensitive to dairy proteins such as casein and whey, which can cause inflammation in the body. Chronic inflammation is a known risk factor for various cancers, including prostate cancer. For those with dairy sensitivities or intolerances, consuming dairy can exacerbate inflammatory processes and contribute to prostate problems. Next we have grapes. Grapes, known for their sweet taste and numerous health benefits, can surprisingly pose certain risks to prostate health when consumed in large quantities. One of the primary concerns with grapes is their high sugar content. Grapes contain a significant amount of natural sugars, primarily glucose and fructose. Another issue with grapes is their potential to cause digestive discomfort. Grapes are rich in fiber, which is generally beneficial for digestion. However, consuming large quantities of grapes can lead to bloating, gas, and diarrhea. For individuals with prostate issues, such digestive disturbances can put additional pressure on the bladder and prostate, exacerbating symptoms like frequent urination and discomfort. Grapes also contain high levels of antioxidants, particularly resveratrol. While antioxidants are beneficial for overall health, excessive consumption can potentially interfere with hormone levels. Resveratrol has been shown to influence the balance of estrogen and testosterone in the body. Hormonal imbalances are a known risk factor for the development and progression of prostate conditions. Therefore, moderation is key when consuming grapes to avoid disrupting hormonal balance. Pesticides and chemicals used in grape cultivation are another concern. Non-organic grapes are often treated with pesticides that can act as endocrine disruptors. These chemicals can mimic or interfere with the body's natural hormones, leading to imbalances that affect prostate health. Opting for organic grapes can help reduce exposure to these harmful substances, but it's important to be aware of their potential impact. Grapes have diuretic properties, meaning they can increase urine production. While this can be beneficial for detoxification, for men with prostate issues, increased urine production can exacerbate symptoms like frequent urination and nocturia, frequent nighttime urination. This can lead to disrupted sleep and decreased quality of life, especially for those with an enlarged prostate. Next we have mangoes. Mangoes are often celebrated for their delicious taste and nutritional benefits, but they can have certain properties that may be harmful to prostate health. One of the primary concerns with mangoes is their high sugar content. Mangoes contain a substantial amount of natural sugars, primarily fructose. Another issue is the potential for mangoes to cause digestive discomfort. Mangoes are rich in dietary fiber, which is generally beneficial for digestion. However, consuming large quantities of mangoes can lead to bloating, gas, and diarrhea. For individuals with prostate problems, such digestive disturbances can put additional pressure on the bladder and prostate, exacerbating symptoms like frequent urination and discomfort. Mangoes also contain significant amounts of beta-carotene, a powerful antioxidant. While antioxidants are crucial for overall health, excessive intake of beta-carotene can potentially interfere with hormone levels. Maintaining a proper hormonal balance is essential for prostate health, and disruptions caused by high levels of certain antioxidants can increase the risk of developing prostate conditions. The presence of certain chemical residues in mangoes is another concern. Non-organic mangoes are often treated with pesticides and other chemicals during cultivation. These substances can act as endocrine disruptors, mimicking or interfering with the body's natural hormones. Hormonal imbalances are a known risk factor for prostate conditions, including prostate cancer. Opting for organic mangoes can help reduce exposure to these harmful chemicals, but it's important to be aware of their potential impact. Mangoes also have a high glycemic index, GI, meaning they can cause a rapid spike in blood sugar levels. High blood sugar levels can lead to increased insulin production, which is associated with inflammation and cancer growth. Consistently high insulin levels can promote the growth of prostate cells, increasing the risk of prostate enlargement and cancer. Managing blood sugar levels is crucial for maintaining prostate health and preventing related complications. The high vitamin A content in mangoes, while beneficial in moderation, can also pose a risk when consumed in excess. Vitamin A is essential for various bodily functions, but too much can lead to toxicity and negatively impact health. Excessive vitamin A intake has been linked to an increased risk of developing osteoporosis, which can indirectly affect overall health and well-being, including prostate health. Next we have pineapple. Pineapples are widely enjoyed for their sweet taste and nutritional benefits, but they can have certain properties that may be harmful to prostate health. One of the main concerns with pineapples is their high sugar content. Pineapples contain significant amounts of natural sugars, primarily fructose and glucose. Another issue is the potential for pineapples to cause digestive discomfort. Pineapples are rich in dietary fiber and bromelain, an enzyme that aids digestion. While these components are generally beneficial, consuming large quantities of pineapple can lead to bloating, gas, and diarrhea. For individuals with prostate problems, such digestive disturbances can put additional pressure on the bladder and prostate, exacerbating symptoms like frequent urination and discomfort. Pineapples also have a high glycemic index, GI, meaning they can cause a rapid spike in blood sugar levels. High blood sugar levels can lead to increased insulin production, which is associated with inflammation and cancer growth. Consistently high insulin levels can promote the growth of prostate cells, increasing the risk of prostate enlargement and cancer. Managing blood sugar levels is crucial for maintaining prostate health and preventing related complications. The presence of bromelain in pineapples, while beneficial for its anti-inflammatory properties, can also pose risks. Bromelain can interact with certain medications, particularly blood thinners and anticoagulants, altering their effectiveness and increasing the risk of side effects. For men taking medication for prostate health or other conditions, it is important to be aware of potential interactions and consult with their healthcare provider. Pesticides and other chemicals used in the cultivation of pineapples present another concern. Non-organic pineapples are often treated with pesticides that can act as endocrine disruptors. These chemicals can mimic or interfere with hormones in the body, potentially leading to imbalances that affect prostate health. Opting for organic pineapples can help reduce exposure to these harmful substances, but it is crucial to be aware of their potential impact. Next we have spicy foods. Spicy foods, while enjoyed for their bold flavors and numerous culinary uses, can have certain properties that may be harmful to prostate health. One of the main concerns with spicy foods is their potential to cause irritation in the urinary tract. Spicy ingredients, such as chili peppers, contain capsaicin, which can irritate the lining of the bladder and prostate. Another issue is the inflammatory response that spicy foods can trigger. Capsaicin, the compound responsible for the heat in spicy foods, can cause inflammation in the digestive tract and other parts of the body. Chronic inflammation is a known risk factor for various prostate issues, including prostate cancer. Consuming spicy foods regularly can exacerbate inflammatory processes, potentially worsening prostate health. Spicy foods can also lead to gastrointestinal discomfort, including symptoms like heartburn, indigestion, and acid reflux. These digestive disturbances can put additional pressure on the bladder and prostate, exacerbating symptoms like frequent urination and discomfort. For individuals with prostate problems, managing digestive health is crucial to avoid worsening their condition. Another concern is the potential impact of spicy foods on hormone levels. Certain spicy ingredients, such as black pepper and turmeric, contain compounds that can influence hormone balance. Maintaining a proper hormonal balance is essential for prostate health, and any disruptions caused by spicy foods can increase the risk of developing prostate conditions. It's important to consume spicy foods in moderation to avoid these potential hormonal imbalances. The diuretic effect of spicy foods is another aspect to consider. Spicy foods can increase urine production, which might be problematic for men with prostate issues. Increased urine production can exacerbate symptoms like frequent urination and nocturia, frequent nighttime urination. This can lead to disrupted sleep and decreased quality of life for individuals with an enlarged prostate or other prostate-related problems. Pesticides and chemicals used in the cultivation of spicy ingredients present another concern. Non-organic spices and peppers are often treated with pesticides that can act as endocrine disruptors. These chemicals can mimic or interfere with hormones in the body, potentially leading to imbalances that affect prostate health. Choosing organic spices and thoroughly washing non-organic produce can help reduce exposure to these harmful substances. Next we have unfermented soy. Unfermented soy, commonly found in products like soy milk, tofu, and edamame, is a popular dietary choice due to its high protein content and numerous health benefits. However, certain properties of unfermented soy can be harmful to prostate health. One of the primary concerns is the presence of phytoestrogens, particularly isoflavones, which mimic the hormone estrogen in the body. Another issue with unfermented soy is the presence of anti-nutrients such as phytic acid. Phytic acid can bind to minerals like zinc, magnesium, and calcium, inhibiting their absorption in the digestive tract. Zinc is especially important for prostate health, as it plays a crucial role in maintaining normal prostate function and preventing the proliferation of cancer cells. Reduced zinc absorption due to high phytic acid intake from unfermented soy can thus compromise prostate health. Unfermented soy also contains trypsin inhibitors, which can interfere with protein digestion. Trypsin is an enzyme necessary for the proper breakdown of proteins in the digestive system. Inhibition of trypsin can lead to digestive issues and reduced absorption of essential nutrients. For individuals with prostate conditions, optimal nutrition is crucial, and impaired protein digestion can negatively impact overall health and the body's ability to fight off disease. The high levels of omega-6 fatty acids in unfermented soy are another factor to consider. While omega-6 fatty acids are essential for health, an imbalance between omega-6 and omega-3 fatty acids can promote inflammation. Chronic inflammation is a known risk factor for various health issues, including prostate cancer. Consuming unfermented soy in large quantities can contribute to an unfavorable omega-6 to omega-3 ratio, thereby increasing the risk of inflammatory conditions that may affect the prostate. Pesticide residues in non-organic soy products present another concern. Soybeans are often treated with pesticides that can act as endocrine disruptors, interfering with hormone function in the body. These chemicals can mimic or block natural hormones, potentially leading to imbalances that affect prostate health. Opting for organic soy products can help reduce exposure to these harmful substances, but it is crucial to be aware of their potential impact. Last, we have vegetable oil. Vegetable oils, such as soybean oil, corn oil, canola oil, and sunflower oil, are commonly used in cooking and food preparation due to their affordability and high smoke points. However, several properties of vegetable oils can potentially be harmful to prostate health. One of the primary concerns is their high omega-6 fatty acid content. While omega-6 fatty acids are essential for health, an imbalance between omega-6 and omega-3 fatty acids in the diet can lead to inflammation. Another issue with vegetable oils is their high polyunsaturated fat content. Polyunsaturated fats are prone to oxidation when exposed to heat and light, leading to the formation of free radicals. Free radicals are unstable molecules that can damage cells and contribute to oxidative stress in the body. Oxidative stress is implicated in the development and progression of prostate cancer and other chronic diseases. Regular consumption of vegetable oils, especially when used for frying or high-heat cooking, can increase exposure to oxidized fats and exacerbate oxidative damage. Vegetable oils are often refined using chemical processes such as bleaching, deodorizing, and hydrogenation. These processes can introduce harmful chemicals and trans fats into the oils. Trans fats are known to increase inflammation and raise levels of LDL, bad, cholesterol while lowering HDL, good, cholesterol. High LDL cholesterol levels are associated with an increased risk of heart disease, which can indirectly affect prostate health by reducing overall cardiovascular function and blood flow to the prostate gland. Additionally, vegetable oils are often extracted using solvents like hexane, which can leave residues in the final product. These solvent residues may have toxic effects on the body, including disrupting hormone function and potentially impacting prostate health. Choosing cold-pressed or expeller-pressed vegetable oils can reduce exposure to solvent residues and preserve more of the oil's natural nutrients. The high levels of refined carbohydrates in processed foods often cooked or fried in vegetable oils can contribute to obesity and metabolic syndrome. Both conditions are associated with an increased risk of prostate cancer and other chronic diseases. Obesity, in particular, can lead to hormonal imbalances and insulin resistance, which are risk factors for prostate issues like BPH and aggressive prostate cancer.